Right, we're now going to sort of move on. Really, you've got me to bang on for the next sort of 10 minutes. So I'm going to give you a little bit on the Armed Forces Healthcare Training and Education Programme. Next slide, please, Anna Marie. Next slide. So this is what I'm hoping to cover, really, bit of background and context. And I'm conscious that Kate and Tim have stolen a few of my sandwiches. Bit on the aim and objectives, bit on the rollout plan and delivery model as well, and linking that to training objectives and indeed the training modules as well. And then critical, really, I suppose, is the outcomes, and really a call to arms or call to action at the end of it. Next slide, please, Anna Marie. So that was the background. So a lot of evaluation just come to fruition, which was led by the Armed Forces team at NHS England, in terms of the advocate programme, socialist prescribing and the Op Community Pathfinder. And the key element, in fact, the key thread through them programmes evaluation was that how can we expect the workforce to know what to do when they're not trained and educated? So that was really important, and I think was probably a turning point. I think it's worth mentioning that this work is absolutely supported by Nikki Murdoch and the Armed Forces Patient and Public Voice Group, and indeed the Clinical Reference Group. And them two areas are critical to this programme, in fact, to Armed Forces healthcare in general. So absolutely critical. But I suppose it was on the back end of every trust signing the Armed Forces Covenant, which was a major achievement, that we managed to get Amanda Pritchard, next slide please, Anna Marie, to visit Royal Hospital Chelsea, as Tim alluded to. She reaffirmed her commitment to the Armed Forces community. She took talks with Kate Davis to a number of veterans in Royal Hospital Chelsea, and as she was walking out the door, she said, we must do more. And that was also a catalyst for that moving to the next stage. And so Deborah Elliott, Director of Transformation in the Armed Forces team, managed to secure funding to link into that training and education piece. So again, a pivotal moment, really. And it was a really short flash to bang time, actually. So, yeah, big shout out to Deborah, who I'm working really closely with at the moment. Next slide, please, Anna Marie. So this is sort of the aim of the programme. Please don't sweat all that detail, but it's about developing the skilled education and inclusive primary, community and secondary care workforce. And that absolutely links into the workforce plan, actually. So, you know, doing professional development. And this is sort of critical going forward. Next slide, please, Anna Marie. So you've sort of heard the objectives, but just to reiterate, it is about health inequalities, it is about unwarranted variation, and it is about disadvantage. And of course, it's right across that armed forces community. That's the key thing. The other thing as well is trying to increase awareness of the unique characteristics of this community, and all linked into, you know, statutory responsibilities. And I put them in that order specifically because, you know, in my view, to win a clinician over, you talk about health inequalities. You don't wrap them across the knuckles about statutory duties. Every trust has huge amounts of statutory duties. So that is really important to hoist in. Next slide, please, Anna Marie. So in terms of the rollout plan, you know, what is the audience? Well, number of cohorts. You wouldn't be surprised to know that it's across the system. So it's going to be NHS / DHSC, and obviously they are combining over the next sort of year or so. Integrated care boards, and again, they're going through a major reorganisation. Clearly, secondary care and indeed primary and community care. So they are the key sort of cohorts, but I do feel there might be other opportunities. But at the moment, in scope are them cohorts 1 to 4. Next slide, please, Anna Marie. So here's the delivery model. And again, I just want to put this into context. There's 1.3 million people in the NHS. So we're asking an awful lot, A, of the NHS, and B, the training team themselves. But, I see this as a flexible approach, face-to-face virtual. There will be e-learning, there'll be induction videos, there'll be a trainer package. And of course, we'll be providing sort of digital material as well in terms of resource. So again, they are the 5 delivery methods. Next slide, please, Anna Marie. These are the broad training objectives which were agreed at the highest level. Kate Davis assures me, I think she mentioned even at government level, if I'm honest. But the first one, obviously, is to comply with the covenant duty and consider due regard. And again, I just want to shout out maybe some of the terms haven't been used in this specific audience. We talk about the cohort of the armed force community, but I also want to include the bereaved and those that are injured and sick, because there are a few of them. So that is really important, that inclusivity. Training objective 2, we've got to be able to identify this community, and that links into the Ask campaign and identification. Once we've identified them, we can deliver that personalised care. And of course, the big one is leading to improved outcomes for the armed force community, NHS staff, and service leavers as well. And that is really important. So next slide, please, Anna Marie. So these are the 5 modules, again, agreed at the highest level. Module 1 is an introduction video, which will probably be released around the October time. Module 2 is a leadership overview, strategic. Module 3 is probably where the rubber hits the road, if I'm honest, will be that workforce module. And module 4 will be e-learning. And again, we're working on a package there. And of course, more importantly, we're going to leave a train the trainer package. So we're going to hand responsibility over to armed forces leads, armed forces champions within organisations. But of course, we are there to support. So that is really important to hoist in. Next slide, please, Anna Marie. So it won't surprise you to hear that we've conducted a number of focus groups. So the material has been co-produced. And I have to say, actually, I've been under a bit of pressure and scrutiny, again, at the highest level and from some big hitters. But I think I just wanted to share with you that, this is a team sport. And so I've presented, or my team have presented to senior management team and chairs in the armed forces team. We've presented to the clinical reference group. We've presented the armed forces patient public voice group. We've presented to Chair Gerft, Tim Briggs, and of course a number of NHS trusts. And what actually has impressed me is the quality of the feedback. It's been measured, proactive, supportive and positive. And that has been sort of enlightening, if I'm honest. But I think the key thing is that, of them 205 odd trusts, 71 trusts have actually engaged in this process, which is brilliant. And on the right of the slide, you can see by region, that trust engagement. So again, a shout out to all those who supported the focus groups. It's been a hard slog, hard fought yards actually, but we are almost there. And the other thing as well is that we've conducted a number of you spoke, we listened workshops as well. And again, it wouldn't surprise you that we've involved the armed forces senior management team, the armed forces patient public voice group, and various trusts, and we are almost there. So real co-production. Next slide, please, Anna Marie. I think in terms of outcomes, obviously, one of the key things is raising awareness. And again, I think Tim mentioned it. What we're doing for the armed force community will raise standards for everyone in the NHS. And I think that's the smart bit of this programme. It really is. But I think in terms of them outcomes, again, strategy, it links into the 10-year plan that Kate mentioned. It's about confidence in practice and that personalised care. So staff know how to deal with this unique cohort. Connection, to the third sector. Absolutely critical. And I know it's called the third sector. I think it's probably called the essential sector, actually. So a big shout out to everyone out there, our partners. Access to learning links into that workforce plan, right? We improve the workforce. And if we improve them and do professional development, they'll stay with us longer. And that is really important. And I suppose the critical element to the outcomes is about reducing them inequalities and improving that patient experience. So it's going to be, you know, a challenge, but the training team are absolutely up for this. Morale is very high. They cannot wait to get out there and deliver stuff. Next slide, please, Anne-Marie. Again, I just wanted to give you a feel for engagement across the trust. And I know that the trusts are under the cosh, operational pressures all the time, you know, strikes, you know, a new variant of COVID. I mean, it's huge challenges and, of course, a reorganisation. I mean, you couldn't write all this stuff, right? But what has really impressed me, and the green bar along the bottom, is when we sent out an initial email to trust chief execs, all 205 of them, the response rate has been absolutely huge, 82%. Now, if you look at that in engagement terms, I'll be honest, generally you'd get a 5% return, but we've had 82% trust. And that will be for various reasons. It will be the Armed Forces team continuing to drive that agenda. It will be about the VCHA team. It'll be about the ops suites. It'll be about the GP scheme. It will be about the third sector. So, you know, absolutely huge response. In addition, we had some sort of draft surveys. And again, I'm staggered, you know, half of them trusts have responded, which is absolutely incredible. So I get a real warm feeling about this, you know, and I know we can absolutely deliver this, but it is a team sport. Next slide, please, Anne-Marie. I thought I'd just give you a bit on the programme timelines. I've never seen the NHS work so quick. And again, I think it links back to Deborah Elliott driving this programme right at the top with Kate Davis, getting the funding last November. We recruited a team in March, again, a mix of veterans and healthcare professionals, all very professional, you know, and they make me look really good, which is great. April and May really was about induction and orientation. May was the programme concept, and really sort of June, we've done module production. And then, of course, July, we've done the stakeholder engagement focus group. So again, which has gone down really well. And at the moment, August, September, we are in the review and refine modules. And again, you know, Kate Davis sat through the modules last week. In fact, actually, I think it was Monday, wasn't it? Monday. Hugely impressed with what the team had produced, but it was co-produced. And that is the critical thing here. And I mentioned the 5 modules. Modules 1, the induction, module 2, the strategic or leadership, module 3, the workforce, have almost been signed off. In fact, modules 1 and 2 have been signed off. Module 3, a little bit of fine tuning, but we are ready to rock and roll. So in October, there will be a soft launch. And then in November, I'm going to set the team free, and they will start doing operational delivery. And already trusts have booked in training sessions, and again, that really heartens me. I'm actually hugely humbled by people absolutely leaning into this program. Next slide, please, Anne-Marie. So hopefully that update was useful. I'll obviously be around at the end if anyone's got any questions on it. But from now, from me, I'll say goodbye.